So for a vaccine to work, what it does is it trains your immune system to recognize part of whatever you're vaccinating against. So if it's the whooping cough bacteria or the flu virus or the measles virus, that's inside, something is contained in that vaccine, so that when it's injected into your body, that your immune system sees it and forms a response against it. So then when it sees the real thing, it's able to quickly go into action and stop the real infection from occurring. So that could be proteins from a virus. It could be a deactivated form of the virus. We're even getting now to the point where there's just genes of the virus that are being put into vaccines. So I think that it depends on which individual vaccine that you're talking about. So for the flu vaccine, it's parts of the virus. For the measles vaccine, it's what we call an attenuated strain, or a strain that's been weakened that's in the vaccine. And for other things, for example, like the pneumonia, one of the pneumonia vaccines, it's just protein parts of just little pieces of protein from the target that you're trying to vaccinate against. So it all depends on the vaccine, but the general principle is the same. It's trying to train your immune system to see this as a way to develop a response against the real thing when it's faced with it later in time.
So on the topic of vaccines, this makes me think of one of the most common ones, which we've been touching on a lot, which is, the flu and the flu shot. You've already mentioned that you think it's still a threat, still something to be worried about.
Right. So flu is probably the highest on people's list. And one of the reasons is the vaccine. Although I recommend the vaccine to everybody, and it's the best way we have of preventing flu, and we see that it definitely prevents deaths and hospitalizations and pneumonia, it's not the best at preventing the flu in general. So lots of people who get the flu vaccine will have breakthrough infections. It's only about 40 to 60% effective at preventing the flu. And the reason is that we still make flu vaccines the same way we did in the 1940s, that the technology hasn't really been brought to bear on the flu vaccine. And the flu vaccine is something that we have to continually update every year, looking at the strains. We don't have anything close to what's called a universal flu vaccine. So you get a measles vaccine that covers all the measles strains that are out there. There's no such thing for that with the flu vaccine. It's kind of the holy grail in the field, is to make a vaccine that you get once or maybe a couple times, and that's it, because it protects against all the strains. And until we have that type of a vaccine against the flu will always remain a threat, because it's always out there circulating. Flu lives naturally in bird populations, and it's always out there. Many different strains that are in birds that are constantly finding ways to get into humans. And we have no means to stop them because we don't have very good vaccine technology against flu. So that's become a major priority, basically since around 2005, to try and get a better flu vaccine that looks a lot like our other vaccines. It has durable immunity that you don't need to keep updating, that there's not this guessing game trying to figure out which strains to put in it. That whole thing needs to be fixed in order to take flu off the table as a pandemic threat.
And you're saying right now, the flu shots that we have right now, you say they're about 40 to 60% successful at
preventing the flu. But it's important to remember that even if you get the flu, despite your flu shot, the flu you get will be less likely to be severe, less likely to have you go to the hospital, less likely to cause pneumonia, less likely to cause death. So that there's this cascading benefit of the flu vaccine. It's often underappreciated because people always say, I got the flu shot last year and I got the flu. But they don't realize that the flu they got was likely weakened compared to what they would have gotten without the vaccine.
And how long are the side effects?
The side effects of the flu shot are very mild. It's usually just a little bit of injection soreness, maybe some fever and aches for about a day or two, and it's not very.
So just a day or two.
Yeah.
About what other vaccines do you recommend? Like, say, adults. Obviously, children have their recommended list for schools. What do you think about for adults?
So it all depends on their risk factors. So for adults, I think that people should get their flu shot every year. They should get their tetanus updated every 10 years or so, a little bit shorter if they've got a bad wound. There are certain vaccines that we give with age. So these pneumonia vaccines, there's one called Prevnar, one called Pneumovax that we give it starting at age around 65 or so, depending upon a person's risk factors. There is a shingles vaccine that we give individuals as well. Shingles can be a very debilitating disease. And that's kind of the majority of the adult vaccines that are there. And then there's also vaccines you give to people who travel. So, for example, if you go to a part of the world where yellow fever is prevalent, you might get a yellow fever vaccine.
Malaria, I think of.
Well, there's no vaccine for malaria, but yeah, you take pills to take. There's prophylactic pills that you take when you go into a malarious area. So yellow fever, Japanese encephalitis, all of these types of things that you recommend. And there's certain occupational diseases that we give people vaccines for. So the military gets vaccinated against smallpox and anthrax, and veterinarians get vaccinated against rabies with the rabies vaccine. So it all depends on the risk factors. But in general, flu, tetanus, shingles, and the pneumonia vaccines are the ones that are the mainstay of adult vaccination.
Speaking of pneumonia, is it just me, or have there been more? Are pneumonia deaths on the rise? Might just be me, but I feel like I've known a couple people the last couple of years that have passed away from pneumonia when I never knew anyone before.
So pneumonia is still one of the leading, it's the only, if you look at the leading causes of death in the United States, it's the only infectious cause of death. So pneumonia is something that's incredibly common as a cause of death. I don't think that they've gone up over the years, but it is still a major cause of death from an infection in the adults. And it used to be called, one of the old man's friend, they used to call pneumonia, because it was something that people often succumb to with old age, because maybe they can't clear their secretions, they get pneumonia, or they end up in a hospital on a ventilator and they get a ventilator-associated pneumonia. So pneumonia has lots of different ways of occurring, but it is something that has traditionally been associated with death in the elderly.
How can you get pneumonia? I've heard things like, don't go outside with your hair wet, but I don't know if that's...
Pneumonia can be caused by a variety of things. So it's just like any infectious disease. Pneumonia can be caused by bacteria, it can be caused by a virus, it can be caused by fungus.
Oh, so you can get it lots of ways.
Yeah, so most people do, when you talk about bacterial pneumonias, I think what most people are talking about when they generically use the word pneumonia. You have to remember that you've got lots of bacteria that live in your mouth and your nose, and some of those find their way into your lungs, especially if you're debilitated, have another lung disease, you're a smoker. And what ends up happening is that sets up an infection in your lungs, which leads to inflammation and an inability to get the oxygen into your blood from your lungs, and then people become short of breath. That's how pneumonia occurs.
And how long can that live in you when you have it?
It depends. So pneumonia there's no such thing as a sterile site in your body. So there's lots of bacteria even in your lungs now as we speak. But pneumonia needs to be treated usually with a course of antibiotics, like 5 to 7 days of antibiotics, to actually stop that process from occurring when you're talking about bacterial pneumonia. If pneumonia is left untreated, that pneumonia can get worse. It can encompass all of your lungs, put you into respiratory failure. It can spread into your bloodstream and cause a really severe infection. So that's why pneumonia remains a leading cause of death.
Is that something that people can tell right away? Like if you go to a doctor, or is it something you see symptoms of right away? Right,
you do. So pneumonia, you can see fevers, chills, body aches, shortness of breath, cough. Maybe you're bringing something up with you, cough. Those are all signs and symptoms of pneumonia. And then a doctor's office, they may listen to your lungs and listen for abnormal sounds with the stethoscope. That's one way to diagnose it. And then definitive diagnosis is usually done by a chest X-ray or a chest CT scan to actually image the lungs and see if there's a patch of abnormality there that's consistent with pneumonia.
Hey everyone, thanks so much for watching the episode. If you're interested in contributing to the conversation and supporting the show, there's 2 easy things you can do. 1, click subscribe, and 2, visit our Patreon page where you get exclusive access to the Exploring Minds community.